If you know of a child who is having a greater degree of language impairment than other children or has diminished communication skills and also exhibits a restrictive pattern of thought and behavior, he may have Asperger's syndrome. This condition is more or less similar to that of classic autism. The main difference between autism and Asperger's syndrome is that the child suffering from Asperger's syndrome retains his early language skills. The peculiar symptom of Asperger's syndrome is a child's obsessive interest in a single object or topic to the exclusion of any other. The child suffering from Asperger's syndrome wants to know all about this one topic. Sometimes their speech patterns and vocabulary may resemble that of a little professor. Other Asperger's symptoms include the inability to interact successfully with peers, clumsy and uncoordinated motor movements, repetitive routines or rituals, socially and emotionally inappropriate behavior, and last, but not least, problems with nonverbal communication. Asperger's syndrome sufferers find difficulty mingling with the general public. Even if they converse with others, they exhibit inappropriate and eccentric behavior. The Asperger's syndrome patient may always want to talk about his singular interest. Developmental delays in motor skills such as catching a ball, climbing outdoor playing equipment, or pedaling a bike may also appear in the child with Asperger's syndrome. Children with Asperger's syndrome often show a stilted or bouncy walk, which appears awkward. The therapy for Asperger's syndrome mainly concentrates on three core symptoms: physical clumsiness, obsessive or repetitive routines, and poor communication skills. It is unfortunate that there is no single treatment for the children suffering from the entire three core symptoms. But professionals do agree that the syndrome can be cured when the intervention is carried out at the earliest possible time. The treatment package of Asperger's syndrome for children involves medication for coexisting conditions, cognitive behavioral therapy, and social skills training. The Asperger's syndrome treatment mainly helps to build on the child's interests, teaches the task as a series of simple steps, and offers a predictable schedule. Although children suffering from Asperger's syndrome can manage themselves with their disabilities, personal relationships and social situations are challenging for them. In order to maintain an independent life, Asperger's syndrome sufferers require moral support and encouragement to work successfully in mainstream jobs. Studies are on the way to discover the best treatment for Asperger's syndrome, which includes the use of functional magnetic resonance imaging, MRI, to identify the abnormalities in the brain which cause malfunction of the same, which in turn result in Asperger's syndrome. Clinical trials are being conducted to identify the effectiveness of an antidepressant in Asperger's syndrome individuals. Even the analysis of the DNA of the Asperger's syndrome sufferers and their families may cause a breakthrough in the treatment of Asperger's syndrome. For more informative information about health and fitness, please visit us at malehealthclinic.com.